early signs of distress. And this varies dramatically from person to person, so it has a lot to do with knowing the person who you're working with or living with. But these are some examples of strategies, of ways in which emotional distress may show up. So whining, rocking, oops, I'm losing my pointer here. Uh-oh. Okay, there we go. Clenching fists or tensing the body. Pacing, saying no. Not answering, I think, is something to be pretty aware of because it's very common and often can be something that you see before a meltdown or as someone's getting more agitated, being unable to attain their attention. And the other big one that I think people don't always think of is we do see increased escape and avoidance behaviors, and including like extra silliness. So sometimes as people are becoming more upset and agitated, distressed, you see this hyperactivity or silliness. Okay, so that's sort of the early warning signs of that timeline. And so that's a point when, if you notice those things, you want to do your best to divert. Now, again, this isn't directly teaching the person skills, but this is sort of one way to support emotion regulation. So some ways that you can divert are to offer them to take a minute. This is not forcing them to take space or telling them to go to timeout, but this is providing a chance to take a break. If you're working on something that's not a critical behavior, let it go at that moment that you're noticing the problem, or that you're noticing early signs of distress. And this is not to say to like just not ever place demands on someone with autism, because that would not be a good thing to do for their overall development. But certainly when you notice this distress, you don't need to be pushing on something that's not essential to be working on in that moment. Removing the stimulus if there's something you can identify that's really clearly triggering. Redirecting to the next thing with a visual schedule. And I can't stress enough how much that actually is effective. Also with emotion regulation, we're doing a study on an inpatient unit, and we do structured emotion tasks to try and understand some of the mechanisms underlying emotion dysregulation. So to do that, we do some frustrating activities, and we use a visual schedule, and often just pointing out when the next activity is very, kids are then able to self-regulate. They focus on that they can move on to the next thing. Using a visual prompt, like a first then card, offering a sensory option, or simplifying the task if you can break what you're doing down if you see early signs of frustration. There are things that are easy to do by accident that can inadvertently make the situation worse. So I just wanted to highlight some of those things to avoid. One is asking a lot of questions. Asking how someone's feeling. I think this can be a very natural thing that we would do with a friend who appears to be getting upset. But if someone has difficulty identifying their own emotions or isn't really aware of their feelings, this can be actually adding to their stress. Another thing that people with autism actually say all the time really bothers them, and I can very much understand why, is that it's very frustrating when they're becoming upset and someone tells them to calm down. I think most people would say they would calm down if they could, and they're experienced that overwhelming stress that I mentioned on that early slide about meltdown. So it's not really helpful in that situation to tell them to calm down. So to avoid sort of that phrase, if you can. Demanding eye contact, it's usually not a time to do it when someone is distressed because it can increase distress. Talking a child out of a routine. It may be that part of your treatment is working on decreasing and interfering repetitive behavior or something, but often it can be something that the child is doing to give themselves a sense of control over what's going on. Often the routine or repetitive behavior can be calming. So it's not necessarily a time to work on that treatment target if you're noticing increased distress. Trying to get in a debate about something also wouldn't advise. And then again, just asking to do anything except the essentials. So if you're noticing those signs, there are things you can do to support. And the number one thing is to remain calm yourself. Using the child's name when you're talking, simple statements. You can validate their emotion. So instead of saying, "How are you feeling?" you could say, "I can see that you seem mad," or "I could tell that you're upset. How can I help you?" So label it for them. And again, having this collaborative attitude of working on a problem together. And then I think the probably most important thing to do, and just remind yourself, because it can be very difficult in a situation that's escalating, is to remind yourself that the child is doing the best they can with the tools that they currently have. And that will help you support them if you keep that sort of as your framework. I wanted to highlight some other advice taken from my colleagues who work on inpatient units, which are to pay attention to your tone of voice, reduce the number of words you're using visuals to demonstrate the behaviors that are being asked, allowing extra time to process before repeating a direction or expecting a response, and being aware of personal space, because sometimes that, if getting in too close, can be perceived as threatening, or particularly if someone's already becoming overwhelmed, it can add to their sort of sensory overload. So the other thing to keep in mind is that, say someone's really upset, has a meltdown or some other incident, and it's over. It's not necessarily immediately over for that individual. And I think this is where we often see a lot of problems, time and time again, where outwardly the child or adult will look like they're doing fine, you think you've gotten past it, reintroduce asking them to do things, go back to what you were doing, and then it happens again. So I think what's really just important to keep in mind is that they may still be processing the event, they may still be agitated even though they've managed to calm down. So it's very important to remember that the child might not be back to their baseline or back to feeling calm immediately after experiencing a strong emotion or having a behavioral incident. So in that time period, I mean, often when things go really wrong with a big emotional meltdown or a behavioral reaction, the child, it may be against or might have an impact on the people they care about the most, and it can be a time, particularly for those who are really cognitively able, where they feel a lot of guilt and additional stress. So it's definitely a time to let them save face and appreciate that they weren't necessarily doing it purposefully, and acknowledge that it was hard. What can we do to make this easier next time? Things like that. Let some time pass. You can go back to those initial options that I mentioned before as diversion options and offer those things slowly to ease back into what you were doing. And it's also not a time to talk about consequences, like you just lost points or whatever system you're using that might be your behavioral strategy. Again, because they're still probably processing and still probably not fully at their baseline. Whoops.